Hi, this is Mike Pekor from Long Island Hypnotherapy, www.liphypnosis.com. In this short video, I would just like to discuss with you the lost art of psychotherapy. Psychotherapy is the practice of using conversation and relationship to assist another person in improving their own ability to function, to think clearly, to feel good, and to find a way to be happy and satisfied in their own life. Psychotherapy is an art. It's an art that takes years and years of practice, supervision, reading, studying, a wide array of subjects and topics. It used to be, in the times of Sigmund Freud, that the basic idea was to discover the root of a psychological issue or an emotional issue. And in that very discovering of the root, the cure would take place. Since the time of Freud, many things have changed. We now understand that although discovering the origin or the root cause, if there is such a thing, of a particular psychological or emotional challenge may be helpful and shed some light, add some perspective on the current problem, it does not at all guarantee a cure. And there are many methods within psychotherapy today that are very effective, highly potent methods of affecting change in human beings in terms of their behavior, the way they think, the way they feel, their emotional makeup, their psychological functioning. And these techniques come from many different places. Some of them come from within the field of psychotherapy. For instance, cognitive behavioral techniques and methods. And some come from abroad, from the other side of the world, Eastern meditative practices, practices of mindfulness. And just like a skilled carpenter must have many different tools in his toolbox, a skilled psychotherapist must have many different approaches at his or her fingertips to utilize with each individual client. And furthermore, just because a psychotherapist does have a wide variety, a large collection of tools, approaches, methods, certifications, that does not guarantee that their ability to use those tools with precision, with talent. Now that is a skill that comes, again, only after many years of practice, supervision, deep introspection. So you need the tools and you need the know-how. You also have to just happen to be a person that sincerely cares about people. If you're a person who doesn't much care about others, you wouldn't be a very good psychotherapist. And if you're a person who cares very much about other people, you have one very essential basic ingredient. But again, that's not the whole shebang. You need the training, the tools, the supervision, the experience. Nowadays, a psychiatrist can see 10 or 15 people in 1 hour, listen to them, and diagnose and prescribe medication and send them on their way. So they can bill their insurance companies 15 times for each hour that they work. It's very profitable, and it makes sense for psychiatrists to do that. And then they recommend that a person who, for instance, they've just prescribed an antidepressant or an anti-anxiety medication, they recommend to them that they seek out counseling or psychotherapy with a social worker, maybe a psychologist, a hypnotherapist, a mental health counselor, any number of mental health professionals. And the thing to know about mental health professionals is that most of them, when they receive their certification or their licensure from the state, have not done very much therapy. The bulk of the training is academic, research-based, understanding the scope of the professional practice. But actual hands-on, person-to-person therapy is something that's very rare in training programs. So people resort to going to postgraduate training programs, sometimes in psychotherapy and psychoanalysis and hypnotherapy. There are so many different methods and approaches. But without that training, a person could potentially have a PhD in psychology and have no idea how to be with a patient or a client in a therapeutic situation. Psychotherapy is a powerful, real method of helping people. Medication is very helpful and has its place, especially in a crisis situation where somebody is just so depressed, so anxious, that they're not even able to benefit from therapy. But once they've reached a level of stability, psychotherapy can be a potent remedy to these issues of anxiety, depression, any number of mental, psychological, emotional challenges. Mike Pekor, liphypnosis.com.